Good morning, everyone. This is Dr. Mortada, second-year fellow in cardiology program here. Welcome to Aurora Sinai Medical Center. Behind me here is Milwaukee Heart Institute, where most of your time you're going to be spending in this building. This building located in Medical Center here in Aurora, and this is in Milwaukee downtown. I'm going to show you, I'm going to be your tour man, show you all the areas you're going to be spending your time during the next 3 years. Let's go on the tour and see what's fun we have inside. Okay, let's start with our outpatient. As you can see behind me, here's the waiting room for the patients. And let's go inside and see where we examine the patient and take care of them there. As we walk in the hallway, you can see on the left side here the patient scheduling. And we have Ricky here and Marie. We are our best to do the schedules for the patient. To your right side, there's the nursing station and secretaries who do the scheduling and take care of our orders for the patients. Hey, Melissa, working hard. In each quad here, we have 4 exam rooms, and we have 2 offices. You can see, let's look at one of the offices where we sit down most of the time, looking at the computers, the labs, and discussing with our attendings about the patient's care. One of the exams rooms, let's go inside. You can see there's chairs for the patient, chair for you, and there's a computer. You can look at the labs and the orders which you did before. And this is the bed for the patient. We can check also their vitals while they're here. Also, as you can see, we have the arrhythmia service clinic just by our side on the left side. If we have a patient with arrhythmia problems, we can just refer them right away down here. We can walk down to the electrophysiology attendings. We can tell them about the story. We have very strong electrophysiology program, and also when you're doing EP rotation, you're going to have a lot of experience here with the very top electrophysiologists in the state. Okay, we're going to the second floor. We have the non-invasive lab. Let's start with the stress lab. Hey, good morning, Barbara. How are you? Preparing for the next patient. As you can see, this is the treadmill, and this is the bicycle. We can let the patient walk on for the first pass. And on those monitors here, where Barbara's standing, we do the blood pressure and the heart rate monitoring, as well as the EKG. The bed here is for the pharmacological stress test if we're giving the adenosine or the dobutamine. Hey, good morning, Dr. Solis. This is our third-year fellow. We have here 3 rooms for the stress lab. We have those 3 rooms are available for treadmill as well as for pharmacological. When we inject a nuclear, we get the patients down here to those rooms. We have 3 cameras. We do the pictures for the heart, SPECT imaging, as well as the gated imaging. And this is an example for one of our cameras. It has 2 eyes, make it faster for us to do all the pictures. And after that, we get on that monitor all the pictures, and the technicians here make it ready for us to read it in the reading room. Let's go to the reading room and look at those pictures over there. Okay, this is our reading room. Hey, good morning, Dr. Pabi. How are you? This is our first-year fellow. And Dr. Asgar, good morning. How are you? She's one of the residents rotating in the stress lab. Here we sit down and relax, and we look at the pictures for the stress test. As you can see here, one of the patients had a stress test. Looks like normal, very good for the patient. Okay, we're still on the second floor. This is the second part of the second floor. We have the echo lab. As you can see, there's 4 echo labs. This is one of the rooms. Let's go inside. Hey, good morning, Slav. How are you? So you're ready for the next patient. This is the echo machine. We use Philips, and we do the ultrasound of the heart as well as the peripherals. Let's go to the recreational room where the technologists, they sit down there and they prepare for the next patient. And here they sit down and relax and put down the papers together. Hey, good morning, everyone. How are you, ladies? Let's go to the reading room where we sit down with Dr. Gal and look at the echoes, as well as sometimes with Dr. Malik. I think Dr. Gal is reading echo here. Morning, Dr. Gal. It's a little bit darker room just to look at the echo, and you can see there's 2 monitors, one big monitor if we allow fellows sitting down in the back. This is Dr. Asgar, one of the internal medicine rotating in the stress lab as well. And here we spend a lot of time as first year as well as second and third year, so you're going to come a lot, and you're going to see a lot of echo reports here. We're on the 3rd floor right now. We have the cath lab and the EP lab. Let's go and look at the cath lab first. Okay, this is one of the cath lab rooms. We have 3 rooms. Each room has a control room where the technician will sit down here and monitor our work inside. Let's go inside and see what do we have. Where we work with the nurses here, we have the table for the patient laying down, and there's the camera above the patient. Will be rotating around the patient. Those are the monitors. We'll be monitoring the patient, looking at the angiograms. We do here the coronary angiograms as well as the angioplasty, as well as we do the peripheral angiogram, the angioplasty, carotid angiogram, angioplasty, as well as the renal angiogram and angioplasty. I have a lot of experience here. For the last 1 year, I had about 300 cases being done. So by the end of your 3 years, you're going to have enough cases to feel very comfortable in your practice. Okay, this is one of the 2 electrophysiology rooms. As you can see, this is the control room. We sit down and do the electrophysiology studies. Let's go inside and see what fun we have there. We have this is the table where the patient laying down, and above the patient is the camera for the x-ray. Those are monitors. We are monitoring the procedure during this type of procedure. We do is the TEE with cardioversion. We do transseptal with atrial fibrillation ablation, the SVT ablation, electrophysiology study, as well as we do implantation for pacemakers and ICDs. That's most of the procedure you're going to do in your rotational electrophysiology. This is the area we will sit down as a fellow. We have 3 areas like this one. We have a computer here. We can access our emails. We can access the labs for the patients. Also, we spend a lot of time here preparing for presentations, making slides, PowerPoint slides, or presentation for the research programs which we have. Welcome to St. Luke's Medical Center. This is our 2nd stop. The nice about having St. Luke's also is bigger center. It's different population you're going to see. Most of those population are Caucasian and Hispanic. Compared to Sinai, which is a downtown hospital, you're going to see more African American patients. As you can see behind me, this is the lobby. And here we're going to see all the cardiology centers. This is the stress lab. We have multiple rooms. Those are the examples. We have a treadmill here. Also in the other room we have a pharmacological stress test. We monitor the patients, we inject them with the nuclear, and then they go to have the pictures in different rooms for the nuclear pictures and imaging. This is the same day where the patient will come before going to the cath lab. Let me show you an example for one of the rooms here in the same day service. Here we see the patients before they come to the cath lab, and we get their vitals. The patient will be monitored, and the blood samples will be taken. After they will be ready to go to the cath lab, we'll go over there and see what do we do there. This is an example for our cath lab here in St. Luke's. There's about 9 cath labs in St. Luke's and 5 electrophysiology labs. Behind me you can see this is the table for the patient. Those are the monitors, the x-ray, the tower for the angiogram. In these labs we do multiple procedures. We do coronary angiogram, angioplasty, peripheral angiogram, angioplasty, renal, carotids, as well as AAA repair. And also we do PFO closure and ASD closures. Next door we have the electrophysiology lab where we do the transseptal with atrial fibrillation ablation, A-flutter ablation, SVT ablation, VT ablation, and also we do the implantation for pacemaker, ICD, and biventricular pacemaker. More than that, we also have about 42 cases every day in this cath labs done, and you can count them how many cases we do a year. We are in the tower right now. There's 12 floors. We are on the 8th floor. We have the CICU here. There's 4 units. This is one of the units. Let's go inside and see the CICU. There's about 30 beds there. This is the CCU, and over here you can see the monitors for the EKGs and rhythm strips. If there's any arrhythmia for any patient, this will give us a note, and we'll know if there's any problem with the patient. Let's go over here. This is the area where we'll sit down and monitor the labs and the EKG as well. We can review the echocardiograms and the cath angiograms. Here we put down the charts where we pull them out and put our notes in. And the patient will be sitting and laying down in his bed inside. Let's go inside and see. The room has the bathroom this side, and this is the bed for the patient. This is the monitor where we see if there's any arrhythmia or not. On the other side of the room, you can see the TV, and it has a VCR as well for the entertainment for the patient. In the corner there, there's a camera, which is the eICU, electronic ICU where those patients will be monitored by nurses in one center, and if there's any problem, they're going to call the nurse down here. In this room, we see a lot of patients, cardiac patients, ST elevation, MI, non-ST elevation, or even patients going for transplant, CHF patient. Also, we see them after the transplantation. From this bed, we took a lot of patients to the cath lab for ST elevation MI. Also, we took them to the cath lab for right heart catheterization, as well as biopsy after the transplantation. One of the departments we have in cardiology is the cardiac rehabilitation. Let's go inside and see what do we have here. We have two sections for the cardiac rehabilitation. One section is the education, which is very important. The first part of the education is the signs of symptoms of cardiac problems as well as stroke, and this is the area where the patient will sit down and read about the symptoms and signs. The second part is the also very important part is the nutrition part. And this is the area where they sit down and read about the nutrition, and they have more counseling information. The third part is very, very important part is the smoking cessation part. It's one of the important risk factors for coronary heart disease. Okay, this is the second part of the cardiac rehabilitation. This is the area where the patient will come do their stress and their exercise on treadmills, on bicycles, weight lifting. And all those actions are being monitored by the nurses. Also, there's a physician on site. If there's any problem, they intervene right away. This is our call room where we rest. We indeed have our call from home, but if you need to stay in the hospital, that's what we stay in, and that's our bedroom. Resting area. We have the fax machine behind you, and we have the computer if there's a need to look at the labs, as well as there's a printer, you can print those out. We have our own shower and our own bathroom. If you need a phone, there's a phone here. And by this room, there's a line where there's a kitchen. If you have your food in, you can put it in this fridge. You can put it in the microwave then and heat it for yourself and eat and enjoy. Okay, this is our cafeteria. As you can see, there's a variety of things you can eat from. The cafeteria is open from morning at 6:30 until evening at 7:30 p.m. Also, if you're stuck in the hospital, you're on call here, and you're hungry, you can come at midnight around 12:30. It opens until 3:30 in the morning. I'd like to finish our tour in the library, where we have a lot of textbooks you can read and journals you can look at. Also, if you have anything to pull out from the internet, we have the computers here. We can review all the journals there, and you can print those out. And if you're really busy and you have an article which you can't find it, you can call over here. We have a lot of assistants and very nice people. They can pull those articles and they can fax it from different places for you. This is the spot which I like to sit down and catch up on my readings. I pick up my favorite journals to sit down here. And also, not only reading, I do my research as well here. Sometimes the paperwork, I finish them down here. It's more relaxing, more quiet here in this area. I enjoyed the tour with you. Hopefully you enjoyed it also with me. You saw all the facilities, and you're going to decide which program you're going to go to. I hope that you're going to put this Aurora Sinai Medical Center in St. Luke's as your first choice, as I did. And I will see you next year, hopefully. Good luck for everyone. You take care.